On February 19, 1994, in a small hospital in California, a woman walked into the emergency room struggling to breathe. Within minutes, 6 people would collapse. Dozens would be evacuated. And one woman would earn a name that still terrifies medical science. Gloria Ramirez, the toxic lady. It was a quiet Saturday evening at Riverside General Hospital. Doctors and nurses were preparing for another routine shift. Then, at 8:15 p.m., the ER doors burst open. A 31-year-old woman was rushed in on a stretcher, gasping for air, her body trembling. Her name, Gloria Ramirez, a mother of 2, suffering from late-stage cervical cancer. But no one knew yet, she was about to unleash chaos. Doctors tried to stabilize her. They gave her oxygen, sedatives, and electric shocks to steady her heart. Then the nurse drawing Gloria's blood noticed something terrifying. Her blood smelled like ammonia, she said. Moments later, another nurse saw crystals forming inside the blood sample tube, tiny white particles floating like frost. Before anyone could react, the chemical odor grew stronger. Staff began coughing and feeling dizzy. Then one nurse collapsed. Then another. Then the doctor. The ER turned into chaos. People were fainting, vomiting, gasping for air. A total of 23 people were affected, and 6 collapsed completely unconscious. The hospital declared a code orange, a hazardous materials emergency. They evacuated the entire emergency ward, leaving only a small team wearing masks and gloves to stay behind. Inside the trauma room, Gloria Ramirez was still fighting for her life. But within minutes her heart stopped. At 8:50 p.m., she was pronounced dead. And yet, her body was still making people sick. Even after death, the smell didn't fade. Her skin had an oily, strange sheen, almost like covered in grease. The coroner staff wore hazmat suits to handle her body. But when they tried to move her, one technician started vomiting and fainted. The entire morgue was sealed off. Scientists were called in from across California, chemists, toxicologists, and even NASA consultants, all asking the same question. What was coming out of her body? The investigation lasted months. And what they found was more disturbing than fiction. Some experts claimed it was psychological, a panic reaction that spread through the ER like a chain. But this didn't explain the ammonia smell, the crystals, or the physical collapse of multiple staff. These were real symptoms. Others believed Gloria had been using a home pain remedy, dimethyl sulfoxide, DMSO, a solvent that was popular at the time. It can build up in fat tissue, and when exposed to oxygen during emergency treatment, it may have converted into dimethyl sulfate, a toxic gas that causes nausea, paralysis, and even death. If true, that meant her body had chemically transformed itself into a toxic cloud. Some whispered darker theories, that Gloria had been exposed to a secret chemical spill or experiment. But no evidence of any military or industrial accident was ever found nearby. Gloria's body was kept in a sealed aluminum coffin for 2 months before doctors dared to perform an autopsy. When they finally did, her organs were badly decomposed, far more than normal for that short time. And the strange oily substance still coated her skin. Toxicologists tested everything, her tissues, blood, and air around her. Traces of dimethylsulfone, a byproduct of DMSO, were found in her system. It supported the toxic transformation theory, but nothing could be proven with 100% certainty. The hospital staff never forgot that night. Nurse Susan Kane developed chronic breathing issues. Julie Gorchinsky was hospitalized for 2 weeks with liver damage and bone pain. Some quit medicine entirely after the trauma. The family of Gloria Ramirez demanded justice, insisting she was treated unfairly, that her dignity was lost under a mountain of fear and science gone wrong. To this day, her children still live with questions that no one can answer. The official report labeled the event as an accidental chemical reaction. But even now, scientists disagree. No one has ever been able to reproduce the same symptoms, smell, or reactions under lab conditions. Gloria's case remains one of the strangest medical mysteries in history, studied in hospitals worldwide as the night the human body itself became poisonous. Locals in Riverside say that when you walk near the hospital at night, sometimes there's a faint smell, like ammonia, just drifting through the halls. And everyone who was there that night remembers one thing. It wasn't in our minds. It was real. We could feel it in our lungs. What happened to Gloria Ramirez that night? Was it science? Or something beyond it? The human body holds secrets we're still afraid to touch. And sometimes, the cure can become the curse. Subscribe to True Mystery Vault, where every story is a piece of reality the world couldn't explain. Because truth is always stranger than fiction.